thank you very much, and I want to, before I start, just give really heartfelt thanks to the Research Foundation for funding our research. Without the opportunity to apply for these grants, that we're really, kind of caught in our ability as clinicians to be able to move forward. So I want to thank you for the opportunity for funding us and to let me talk about this project that we're very excited about at Children's. So everyone in this room knows that solid organ transplant provides life-saving care for children with end organ failure. And the good news is that survival rates for our patients continue to improve year on year for children transplanted at the sort of the spectrums of newborn patients right through to 18 years of age. Our patients continue to live longer. However, the consequences of having a solid organ transplant are that patients need to take lifelong anti-rejection medication or immunosuppression, and they require lifelong medical follow-up. So despite our improved survival rates, non-adherence to medication and to medical appointments occurs, and up to somewhere between 30 and 30 to 70% of patients who are non-adherent to either their medication or their medical appointments results in serious or life-threatening illnesses. And the reasons for non-adherence are not black and white. It's not easy for me to say take a medication, go and take it every day, keep coming to an appointment. There are lots of multifactorial reasons, but as a result, because adolescence is a complex time for teenagers who are normal, if there's such a term for a teenager, we know that sort of poor communication or poor engagement with adolescents as their healthcare providers can all contribute to this non-adherence with both medication and medical appointments. So what do we do at BCCH? Across our solid organ or multi-organ transplant program, we follow 128 patients in total, 70 of whom are adolescents, and 43 of the children that we look after live outside the Lower Mainland. In the last 10 years, and these are sort of crude numbers, 10% of our cardiac patients, 8% of our renal patients, and 3% of our liver patients have lost their graft in some form of way that we can relate to non-adherence. So what is adolescence then? The World Health Organization defines adolescence as a period of life with specific health and developmental needs and rights. It's also a time where teenagers develop skills and they learn how to manage their emotions and develop relationships. They acquire attributes and abilities that will be important for them both enjoying their adolescent years and then going on to assume the adulthood. But for many of you who are teenagers or who have had teenage children, or as a physician myself, it's a time when I get told that we know everything already, you don't need to tell me anything. So adolescent years are challenging for the teenagers, they're challenging for their families and their physicians and the entire multidisciplinary team. And for the patients that we look after, teenagers are often receive their solid organ transplant, especially in the cardiac population, whenever they were infants. So they don't know how sick they were. However, their parents actually do. Their parents went on that journey with them. They, travelled often, before we became a transplant centre across the country in Canada and down to the US with their very, unwell newborn infants to have them have the transplant. And they had the responsibility of making these difficult decisions for their children at the time. And we then, sort of in their teenage years, want to all of a sudden give them this independence and onus that takes away from their parents, and that transition is difficult. So we want our teenage patients to be normal. We want them to have their sort of own identity, be accepted among their own peers, to develop autonomy. However, we also want them to take daily medications, come to appointments, go through invasive tests and procedures, and that all interferes with the process. So we know that non-adherence is associated with poor outcomes. We know it's associated with increased episodes of rejection and graft loss. Patients need extra clinical interventions, and this also, has an additional healthcare cost to the wider community. And patients who are non-adherent report a lower they self-report a lower quality of life than patients who are adherent to medical care. What also happens in the teenage population, which is different to the adults, is that they have to graduate not only from high school, they have to graduate from the pediatric hospital and the service where they've been looked after and cared for 18 years to the adult program, again, where we go from this very sort of parental approach to looking after our patients to all of a sudden at 18 or 19 expecting them to be independent and both functioning for themselves. We know that this time is a time of vulnerability for our patients is associated with graft loss and death in our solid organ transplant patients. We know that psychosocial outcomes at this time of transition in solid organ transplant patients are reported to be lower than their healthy and age-matched peers. However, we do know that reporting a good quality of life at this time of transition is a good construct to having a successful transition and going on to do very well. So quality of life is something that we value really very highly among our program, and quality of life means doing all the things that normal, inverted commas, teenagers do. That means going to school, socializing with your friends, playing sports, doing whatever it is that you want to be able to do, going on to college, getting a part-time job, all the things we want to encourage you to do to be independent. Immediately after solid organ transplant patients report an improved quality of life. They've been unwell, they've been on dialysis, and all of a sudden they have a new organ, they feel better. However, roughly a third of the patients over time go on to report difficulties with adjustment. They report lower quality of life across all solid organ transplant groups, and overall they report lower levels of functioning in both their physical and psychosocial health. But the flip side again is those patients who have a good quality of life go on to be well-adjusted adolescents, and they are more likely to go on to lead independent lives as young adults. Executive function is something that hasn't been widely studied in the pediatric and solid organ transplant population, and executive function refers to a set of cognitive skills that are required to plan and execute complex tasks. And complex tasks are actually complying with taking medication twice a day at very fixed specific times, ordering medications from your pharmacy, knowing when you have to go to the laboratory to have blood work done, knowing when you have to attend for your medical appointments. And these don't sound necessarily like complex tasks to adults, but they're certainly complex tasks for teenagers. And the very little work that has been done in the solid organ transplant patients looking at executive function shows that they do take longer to develop their executive function than their age-matched sort of healthy peers. And we feel that one of the areas that we could help to improve this is by improving our communication to help those with lower executive function as that matures with time, that we can help them through their journey. So what we don't really know about non-adherence is how poor communication contributes to this. We think that I know we don't do a great job of communicating with our adolescent patients, but we need to do better, and that's really where the thought process behind this project came from. We evaluate adherence in very crude ways. We look at their attendance with medical appointments, how regularly they get their laboratory testing done, and we look at their therapeutic drug levels, so their immunosuppression levels. For example, we give you a target tacrolimus level of 4 to 6, and we know that the more time you spend within your target range, the more likely you are to be adherent to your medication. Understanding that in teenagers, things like growth spurts, hormonal changes, illnesses can have fluctuations in this, but we don't look at 1 or 2 numbers. We look at sort of a period over a long period. We look at numbers over a prolonged period of time. And typically non-adherence is associated with increased variability in the trough levels of immunosuppression. So mobile health is an area of growing interest in all chronic healthcare conditions. It's defined as a medical and public health practice which is supported by a mobile device such as a mobile phone, patient monitoring devices, PDAs, and other wireless devices. And what we're going to focus on is short messaging service, or text messaging, which is the most widely used data service in the world, with 24 billion text messages sent and received daily. Upwards of 75% of adolescents have access to a smartphone and are reported to send somewhere between 30 and 100 text messages a day. It's a low-cost, accessible, and preferred way for teenagers to communicate. If I say to some of the heart transplant patients that I look after, we can telephone you or we can email you, they're like, whoa, I don't want to hear, I want a text message, or some patients have told me they want Snapchat, but we're not going. So text messaging offers this two-way communication between healthcare providers and our patients, and we think it's got tremendous potential as a way for us to communicate with our teenage patients. So the hypothesis for the research that has been funded is that a healthcare-specific text messaging platform is a feasible tool to help us communicate with our solid organ transplant adolescents. It will improve their quality of life, their adherence to medication, and compliance with laboratory testing compared to our current standards. So all 70 solid organ transplant patients within our program will be eligible to the inclusion. And the way this text messaging platform works, they need to be able to speak and communicate in English. So that will be an exclusion criteria for now, but that might evolve with time as well. We've been very fortunate that Children's Organ Transplant Society has agreed to donate cell phones to those families who want to enroll in the study but who don't have access to a cell phone. And because this is a text messaging platform, they don't actually need Wi-Fi, and it doesn't sort of bounder onto any sort of internet access. They just need a cell phone that they can actually text message in. And the text messaging platform is going to be provided by WellTel Incorporated, which is a BC, Vancouver-based company, and it's actually founded by Dr. Rich Lester, who is an ID physician here at UGH. And he developed this platform when he was working sort of in the field in Kenya, trying to help come up with ways to treat multi-drug resistant HIV in Kenyan women. And what he observed in his practice and while he was in the lab is that everyone, no matter how poor they were, had access to a cell phone. And they started to use this access to a cell phone as a means to communicate with their patients and to engage with them. And you'll see we're not going to go too far from his original script, and hopefully the video will work to show how we're going to use it to communicate with our patients. But by simply reaching out to them once a week and asking how you are, to check in with the women themselves to see how they were doing, they got better patient engagement, they improved their relationship with their patients, and the patients actually started to do better. They actually started to take their medication, and the level of the HIV that they were trying to treat them had started to improve. And this has all been passed through PHSA privacy standards that we hosted on a secure UBC server, and all that work, thankfully for me, has been done in advance. So essentially our participants will get a message once a week just asking, how are you? And we may evolve that language over time with feedback with our teenagers, but we said we would just go with the simple, how are you now, and not what's up or something. I think that's even outdated now. And we will expect our patients then to reply back, hopefully okay or not okay. At the minute, the platform doesn't recognize emojis, but I'm told that they're working very hard on it. So the patients who are not okay will be contacted by a clinical, one of our clinic nurses or one of the team within 48 hours just to check in to see what's going on. And any patients who don't respond will be sent a second message on Wednesday, and again, non-responders will be followed up. Our patients will actually then be able to use the text messaging platform to text us during clinic hours. This is in no way meant to replace sort of emergency out-of-hours practice, but to ask questions that arise, about gym class or hanging out with friends or whatever it is that they want to know that we don't have the ability to answer kind of in real time for them kind of during the week, so that they can ask us questions and we can reply to them. Responses will be generally sort of categorized into okay or okay, and this will all form part of the medical chart. So our nurses diligently take notes of telephone calls and emails and things at the moment that go into the medical record, but this can all be and will all form part of their medical reminder. And in the future, we will be able to send out appointment reminders through this platform as well, a little bit like you get from your dentist already. We haven't quite worked that out in BC Children's, but there's lots of different ways within this that we'll be able to hopefully promote good health care and to send out reminders for our patients as well. I'm going to see if this video will work. Okay.
More promises. Okay, let's see.
So hopefully I'm going to be able just to show you the video from WellTel itself, and this is sort of to tell you a little bit about it. And
WellTel Health is redefining the way healthcare professionals operate. WellTel Health is part of the non-profit society WellTel International. Globally, it's one of the first and leading evidence-based digital outreach programs supporting adults.
Very difficult to hear.
Yeah, sorry.
Our solution enhances the current standard of care with the delivery services and follow-up, while remaining patient-centered and driven. Designed to simplify tracking and triaging of large cohorts of patients, we achieve the best of all worlds: patient outcomes, communication, and scalability. WellTel helps expedite interaction between patients and their healthcare providers. We can connect people to individualized care when they need it. Aim to put health in your hands. Patients are enrolled to the WellTel platform using their phone number. They receive simple and direct messages to their phone. They reply back okay or not okay. If they are not okay or they do not reply back at all, they will receive a follow-up call or video chat from their clinic or an outreach organization. The platform also automatically sets appointment reminders for the patient. It is affordable and easy to adopt. There is no learning curve, meaning anyone and everyone can use it. Even in the most remote settings where internet is absent or poor, or people who don't own a phone can use shared access to a treatment buddy or supporter, like a family member, a friend, or a community member. For our providers, the WellTel web interface is designed intuitively. Patients and appointments are easy to keep track of, and triaging is simplified tasks. Adding patients to the system is straightforward, and check-ins are performed automatically, making them timely and efficient. Conveniently, the platform is interoperable with EMRs and is HIPAA and CFR 11 compliant, so our custom data and documentation makes understanding results accurate and effortless. Because better continuous care means fewer emergencies and a healthier patient. The success of WellTel and its work is being recognized globally by some of the world's largest medical journals, such as The Lancet, Nature, and the New England Journal. Some media outlets like CNN Money and Scientific American, and some organizations like the World Health Organization and PEPFAR. There are many more benefits to WellTel Health, but we will let you see for yourself. Visit welltelhealth.com for more information, or to contact us to see how WellTel can work for you.
Okay, so I think that kind of shows you roughly what the sort of platform is like. So the study itself will have two.
Right, forward or back?
We'll have two phases. The first phase will be a non-randomized pilot study which will run on 15 patients, which will allow healthcare providers to get accustomed with using the platform. And the initial plan was to run this over about 12 months to give both the healthcare providers and the teenagers who are involved in it plenty of time to give us feedback. And then the second phase of the project will be a prospective randomized control study where there will be two groups. Group A will start using the text messaging platform at the time of enrollment, and Group B will be delayed by 6 months, and they will initially serve as their own control group. We'll compare the results and evaluation. We'll evaluate the results of the quality of life questionnaires, compliance to medication, and their immunosuppression levels at baseline and at 6 months and 12 months after implementation of the text messaging platform. So our primary outcome measure is to look at quality of life, which is something that we now as standard of care measure in all of our transplant patients on an annual basis. We will also look at their immunosuppression levels, their compliance with their scheduled laboratory testing, and we will use this as an opportunity to look at executive function among our solid organ transplant patients, which will be evaluated using the brief questionnaire. So we expect this to have some challenges and limitations. It will be a learning curve for all of us as healthcare providers and for our patients and for their parents. Primarily, again, as I've said, our communication occurs between healthcare providers and the parents. And we're now sort of trying to encourage our adolescent patients to be more responsible and placing some of the onus on them. So we expect there to be some transition for both the parents and the patients themselves. And we also, as healthcare providers, will have to adjust our current practice to communicating more and more with adolescents. And this project is inherently dependent on cell phones, and there's lots of issues that we know already arise with this. Teenagers lose their cell phones, they get taken away from them in school. There will be sort of times where they won't be able to respond to messages, and we expect there to be some teething problems, but we hope to work those out as they come along. But fundamentally, we hope that this will become a very feasible way for us to communicate with our adolescents. We hope that it will improve their quality of life, improve their compliance with our medical care and our medical teams, improve their sort of time within their target levels of immunosuppression, and ultimately change the standard of care of how we as healthcare providers communicate with our adolescent patients. So I'd like to acknowledge Dr. Hansen, who's the head of our solid organ transplant program and a mentor of mine. He's been very supportive and encouraging of us getting this project up and running. Dr. Human is my a friend and colleague in pediatric heart transplant, and Dr. Orly Gutman is our representative from the liver transplant team. Shu Samatani is the head of cardiology, and he's really been instrumental in encouraging us to get this platform up and running, and has helped to fund some of the actual sort of technology behind it. My research team, Astrid D'Souza, Anita Cote, Tim Overlanders, Sarah Hutchison, Stephen Rathberger, as well as, with you guys here, I wouldn't be standing here today, so I'm really truly honoured. And WellTel, and we're so fortunate to have this here on our doorstep, and are being so easy easy for us to work with, and again, very encouraging of us getting this project up and running.
Thank you so much, Dr.